Hi, my name is Dr. Mazum, and today we are going to talk about cough. So, cough, whenever patient comes with the complaints of cough, we as a homeopath, we find it very difficult to individualize the case because the patient often says that, yes, doctor, I'm having coughing, I'm having so much of cough and this and that. But to individualize a case, you must have the knowledge of individualization. You must have knowledge to differentiate every kind of cough. So I have done this. I have made a chart that will be very helpful in your clinic, and that's going to help you a lot when individualizing a case. So suppose a patient comes with a cough. So first of all, the first thing we have to ask is, what was the causation? How did it started? Why did it started? What did you do? That is the first question. So causation, very important. The second thing that we should be noticing is the type of cough. What is the bouts of cough? It is paroxysmal, it is spasmodic, it is short, it is a single bout, it is in double bout, it is in triple bouts. That's very important in considering a case of cough. The second thing is sound. Is the cough is deep, or the cough is hollow, or the cough is very short, or the cough is like a barking of dog? Third thing we have to focus is it dry or loose? Then we can be thinking of that, does it suffocate the patient whenever he coughs? Does it feel like that his breathing is going to stop? That is suffocative or not? And the third thing is what's the violency of the cough? It is too violent, it is short, it is not so violent. So you have to first you have to ask the causation, then you have to think about these things. And the very most important thing is aggravation and amelioration. At what time does the cough starts? What did you do? What do you do when it starts? Do you go in open air when it starts, or do you stay in a closed room and then it starts? Is there a tickling in the cough, or is it tickling that is causing cough? What is the reason? Change of weather is aggravating or amelioration? So you have to ask these questions. And the fourth is expectoration, the character of expectoration. When the patient coughs, if the cough is loose, and when the patient coughs, there will be expectoration. The expectoration may be profuse, the expectoration may be very little. Then you have to ask the character of expectoration. Is the expectoration is thick, or is expectoration stringy, white, yellow, greenish? You have to ask everything. And the third is you have to ask about the taste. There are so many medicines in which there is written a sweetish taste in the cough, there is written a metallic taste in the cough, there is written a salty taste in the cough, there is written a offensive taste in the cough. So you have to ask this question also. And one thing I have missed here, and I'm gonna do it, that there will be I think, sorry. So you have to ask another thing. What is the odor? Is there any offensiveness? Is there bad odor from mouth while coughing? You have to ask this question. That's all about cough. Okay.